Okay, so like I said, it's Wednesday the 13th. This is day 1 of week 9, which is technically a 2-day school week for me because I only have lecture and I have clinical. So was it Sunday? What's today? Wednesday. So Sunday we got back in the evening. So nothing was done that day except for cleaning, which was a lot. But in terms of schoolwork, I didn't do any on spring break because you know what? Why should I? We get the 1 week off from doing work. Why should I do it on vacation? You know what I mean? So I saved it. So I did a lot of work on Monday. I spent 4 hours working on the immune system, PME, which again is pharmacology. And I spent a good long time doing all the SurePath that was technically last week's assignment. Like, yes, there was stuff to do on spring break, but I did it Monday. So and that was all on cancer. And then I had not, like, after our exam we left, so we were supposed to have gone home and watched a lecture video on diabetes, and I didn't do that because I was so stressed out about packing for the trip and my exam. So I watched that video on diabetes on Monday, caught up to where I think I'm caught up. It's hard to say with all the different places we have assignments. And then last night I finished the lecture video for oncology, cancer, which was almost 2 hours long of a video to watch and take notes on. I also I organized my binder, and I spent another 4 hours kind of getting together. On ATI they have flashcards, but it's not what I thought. I thought it was going to be like 30 minutes, flip through some flashcards, get a little bit more acquainted with the cancer drugs. Y'all, it's not like that. I spent 4 hours in there, and I don't know how they expect you to remember all of that information. I mean, that's just crazy. There was over 20, I think. There was like 20 cancer drugs. And to know everything about all of them, that's insane. I don't recommend going into the ATI pharmacology flashcards because you're not going to learn anything from that. So, I don't even have a suggestion. But like I had said on the last video, I technically failed my second exam because I got a 79 instead of an 80. So I'll be staying late today in lecture to remediate and make sure it doesn't happen again. I'm also headed to school a little bit early so that I can kind of recenter and get back into the mode of being able to focus on what's going on. I want to review my cancer stuff because our instructors told us via message yesterday or announcement that today was going to be really busy. So I want to make sure that I know what I'm doing. So anyway, that's it for this morning. I'm going to head out onto the main road, and hopefully I will not get a failing grade again. I still have a mid-B in the class, so make sure you do all your assignments, folks, because every single assignment counts. Every point counts. You just never know when you're going to need it as a buffer. So I'm going to head out, and I'll catch you guys later. Good morning, everybody. It is Friday, the 15th of March, and it's clinical day, so I'm headed to the hospital at 6 o'clock in the morning now. So let me talk about lecture real quick on Wednesday. So we started off by doing like a what do you know about diabetes worksheet, and then we went over it, and that took a little while. And then we started off with an exam review from exam 2, which was right before spring break a couple weeks ago. And normally on the exam review, there's like 3 or 4 most missed questions. On this exam review, there was like 20 most missed questions. And I mean, I'm talking about a full page worth. So, and 40% of the class was there because they didn't pass. So I don't feel as bad now because 40% of the class didn't pass it. But I am now in a situation where I need to make sure I do much better on the next exam. So we basically, in the exam review, we talked about different strategies. A lot of them have to do with study more, make time to study, but that's all I do is study. So, my professors, in my instance, when I showed them my planner and all of the work that I do, and, I listen to the PowerPoints and I take all the notes and I do all the SurePath lessons. None of these things get you any sort of grade in the class. So a lot of people don't do them. I do them, and I still didn't pass. So, my instructors actually said, maybe you're studying too much. Maybe your brain, just at some point, it can't absorb any more information, and you need to be able to stand up and walk away for a little bit and do something else to distract you, and then come back fresh. So that was a good idea, in theory, but, maybe I'm just anxious because I feel like there's so much work to do. I'm always having to do something, and I feel like if I step away and stop doing schoolwork, it would make my grade worse, and then I would have regrets, and I don't want to have regrets. So I'm kind of in a little bit of a pickle there. Still trying to figure it out. But I did go home after lecture, right after our instructor said that I maybe need to take a break. I went home and immediately started working on a different strategy for my study guide. Decided I'm not going to wait until they put out the study guide. I'm going to go ahead and make my own off of the learning objectives as we go. So hopefully that'll make me more successful. So I went through all of the objectives for all of the different subjects we're going to be doing on this next exam, which is a lot again. And made myself like a little outline that I can fill in. I'm wondering if maybe if I write it in myself, it would absorb better. So I printed the objectives, left space to write, and hopefully that will help. We'll give it a shot. Anything's worth a shot. So anyway, we also did a very long lecture or discussion on cancer, and then we did like a anticoagulant drug worksheet. And I think that was everything, but I mean, it took us right to the end. And then I didn't get home until 3:30 because I had to stay late because of the exam remediation. So it was a long day. I had left the house at 6 and I was up at 5. So, or was it, I got up at 6 and left at 7. I think that's what it was. I got up at 6 that day and left at 7. Today I got up at 5 and I'm leaving at 6. Can you tell I'm tired? Her daughter came into her room at, I don't know if it was 1:30 or, yeah, it must have been 1:30, complaining about something, and she came a couple of times, or was coughing or crying. Luckily, my husband got up and handled whatever it is. So he has the luxury of, as soon as his head hits a pillow or any soft surface, he's out. Me, I will toss and turn for hours until my brain finally gives up the ghost and goes to bed. So it's not easy for me to go back to sleep once I start moving around, especially. So, that's the reason I stopped drinking water around 8, so that when I go to bed at 10:30 or so, I have already gone to the bathroom. I'm not getting up again until I wake up. So, anyway, that's off topic. So and just a quick side note, our instructors sent us an announcement. I don't know if it was later on Wednesday or if it was yesterday on Thursday, but they said we will have a quiz next Wednesday. Don't know what it's going to be on. So far we have covered diabetes and oncology, and this coming up week's lecture is on cardiovascular disease and peripheral vascular disease. So it could be on any one of those things. So clinical. I went the wrong way. You gotta be kidding me. Oh my goodness. Luckily, I can fix it, but it just takes an extra 5 minutes or whatever. Yeah, going to clinical. I'm glad I reminded myself of that. Folks, it's too early. It's too early, and I'm too tired, and people waking me up in the middle of the night. It's not good. I was also up late, taking some of that time to myself to watch a hockey game. So I stayed up later than I normally would have. I went to bed closer to 11 and got up at 5. So not the best. Don't recommend doing that, but it was a really good game, and I just couldn't walk away. Normally we were doing really bad, so I just sent myself to bed. Clinical. So today we're supposed to have our midterm evaluations. I went through and looked at the sheet yesterday, filled in some information like my name and the date, and basically it's not exactly the same as our evaluation form we used last semester for fundamentals. This one is it's more of like check boxes, right? So does the student demonstrate sufficient safety on policies and procedures, stuff like that. And it's like a whole bunch of different things, and it kind of goes through the like the roles of the nurse. It's a little bit aligned with that. But yeah, so I filled that out, and then I put in like student comments on specific things that I have done based off of that list, and then 3 goals that I would like to achieve for the remainder of the semester. And then our instructor said that she will go through and mark it off and fill it out or whatever. So I have that with me. I have 2 blank medication sheets with me so that I can do my meds if we get extra time. We also have a care plan that's due this weekend. It's our second and last care plan. So I don't even know yet what I got on the first care plan. So hopefully it's not terrible. But yeah, so that's due this weekend. And then of course we'll have our clinical reflection journal that's due this weekend as well. And a sim chart, because we have to have like 5 of them done, and I think I've done 2. So I kind of hope that I'm not in med surge today, because it just wasn't my vibe last time. I mean, it's fine if you want to just kind of take vitals and work on a chart, but in terms of interesting, I'm not sure I got the vibe for that. So I kind of hope that I'm doing an observation somewhere, but at the same time, I need to have a patient to do a care plan on and a sim chart. Is there something else? I don't know. It must be the care plan that I'm thinking of. What else? Yeah, so our instructor said she's really excited to see us back after the spring break. So that was really sweet. And I'm hoping for just like a good day. Not that we've had any bad days at clinical. I actually, like I said before, I enjoy the hospital setting much more than long-term care, but for some reason, I just don't like going. I don't know what it is. I just kind of don't like looking forward to it. And I was the same way last semester too. I wonder if it's just a trickle-down effect from last semester. Even though it's a different setting, it's just the same feeling. And it's not that I don't like it when I'm there, because I find it so interesting. I think I just dread like all the work that comes with it and the pressure to finish all of the assignments and everything, because our instructor wants us to get all of our clinical related assignments done that day. She doesn't like us waiting the 3 days that we have, because she's like, why wait? Just do it, get it out of your way, and then you have your weekend. But for me, now I feel like extra pressure to get it done quickly, even though I'm not doing anything the rest of the weekend, and I don't care if I do homework on the weekend, but I want to please her, if that makes sense. So I'm trying to do what she asks, which just puts a bigger burden on myself, because I'm a people pleaser. So yeah, I don't know. Maybe I'm like developing a complex. I don't know. Y'all, nursing school, it is, you're gonna find some stuff out about yourself that you didn't know, and some of it's probably not gonna be peaches. You know, it's probably gonna be some self-reflection there. But anyway, so that is the plan for the day. I do have week 8 scheduled to show, I believe, Sunday. So that'll come out, and then this is week 9, so I will put it together hopefully this weekend and get it ready to go out. Sorry for the inconsistencies on the videos, people. It's just there's a lot going on in my life, and when you're in nursing school, I'm sure you'll understand that one. But for this week, well, actually not for this week, so for this morning, I'm going to go ahead and peace out, and then I will follow up with a discussion about how clinical went, hopefully, so I can finish up the video. All right, you guys, have a good weekend. Talk to you later. Bye. Good morning. It is Saturday, March 16, I think. Hey everybody, it is Saturday, like I said, and I am actually headed to get my hair done, just recolored and stuff, and it's a very early morning appointment at like 8 a.m. so it's pretty early, but I wanted to recap clinical from yesterday. All in all, it was pretty good. I didn't have any negative things to say about it at all. I ended up observing in the ICU. I had this lady who seems like she's got tons of experience, and she had 2 patients in the ICU. She had one who had a COPD exacerbation and ended up on a vent. And then she also had a patient who is a recent kidney transplant back in, well, I mean, not really recent, I guess like 2012. Had a kidney transplant, and is immunocompromised because of all of the medicines that he's on for that. But he came in for a UTI, and they felt like maybe he was getting septic, and then he had a hypertensive crisis, so she had him as well, and his heart rate wouldn't stabilize. He was fine, like he was asymptomatic about it, but his heart rate was like in the 170s. So I learned a lot about cardizem, which helps to lower the heart rate. So that was like a good learning experience there. And then we had lunch, and then started working on some assignments and stuff. If you had all your information on your patient to do care plan, which I think I do. And then, one of the other students in my clinical group came in and said that a patient had just passed away on the floor and on the med surg floor that we were on. And I was like, oh my gosh, and I was like, maybe this would be a good opportunity to see how they, wrap up a patient and prepare them, to be taken. And I was like, what better time than now to just go ahead and witness that. So, me and one other girl went out to find out what was going on with it, and with the process, that is, not the person. And they weren't ready yet. They were still calling like a lifeline, which is a required aspect of when a patient passes away at the hospital. They also deal with organ donation, but every patient has to be reported. So we asked her if she would let us know when she was going to be preparing the patient so that we could either help or witness how it works and everything. And so she did. And then like a group of 6 of us actually ended up going to watch and participate. So, we removed all of the IVs, the catheter, all the EKG leads, and, the stay lock on her leg from the catheter. So everything gets removed. You want to try to treat the patient with as much dignity as you can, because you want to try to envision that person as having been your family, and how you would treat them. And that's a great way to approach every patient, I believe. But, it doesn't change with the deceased, so that's really important. All in all, I thought it was a great experience to witness, because you're going to have to see it at some point, and when you're a student and you're learning so much anyway, you might as well, right? So get that done and over. Some of the students took it rather hard. They held their composure, but you could tell that they were distraught. So everyone takes it a little differently, and as a nurse, you try to be compassionate with not just your patients, but also with your colleagues and your peers, and make sure that you're aware that they're uncomfortable, and understand that everyone deals with these things differently. So I thought it was a good experience, though. And then we pretty much wrapped up post-conference. So, a pretty good day. We have the care plan that's due on Sunday, so I took off the rest of last night. I didn't do any work. I just kind of relaxed. And today I'm going to work on my med sheets. I'm going to work on my clinical reflection journal for clinical, and work on my care plan. And all of those things need to be submitted. So, and I had on my schedule to do the cardiovascular PME, and I did not get around to it with all of the SurePath the other day on Thursday. So didn't end up doing it. So I'll have to do that, which will be actually due next weekend, not this weekend. I'm a week ahead still on the PME, which is how I like it. I want to be a week ahead. I don't want to be waiting until the last minute, because those PMEs take so long. So, so that's where we're at. Busy weekend of homework to do. Luckily, while I was at clinical all day yesterday, my husband was really good about making sure the kids did their projects and homework, or at least some of it, because, oh my gosh, they get sent home so much stuff at age 5 and 6. It's insane. Kindergarten and first grade. And I don't know if you guys know this, but, you know, when I was growing up and when my husband was growing up, even on opposite sides of the coast, we still had like nap time and circle time and sing songs and eat a snack with milk, you know, in kindergarten. They don't do any of that stuff. No, they're doing addition and subtraction and reading. And it's like all they do. So, yeah, I mean, and they just get sent home with just piles of homework. It's really crazy. I don't know when all of this started, but it doesn't seem like it's making kids any smarter by pushing all this stuff to earlier ages. So, anyway, that's neither here nor there. So, I'm going to head out to get my hair recolored, and then I'll work on homework this week. I'll work on getting this video up. There should be a week 8 video, I believe, going to be hitting tomorrow. And then this one hopefully will be up sometime mid to end of this coming week or so. All right, you guys, have a good weekend. Bye.